I'm going to tell you how to properly give CPR to a patient. First thing is you want to check the heart rate, the breathing, make sure your patient is in need of the CPR. Once it's been established, you will insert the appropriately sized endotracheal tube into your patient for the breathing. You want to make sure your patient is in right lateral recumbency. The patient can be in left lateral, but preferably right because the heart is closer to the left side of the patient. Once your endotracheal tube has been inserted, your patient's in right lateral recumbency, you've established your patient needs CPR. Of course, you'll have an assistant with you. You cannot do this by yourself. You will interlock your hands together and you will straighten your elbows. You will keep them locked, and we want to give compressions to the tune of Staying Alive, for instance. So you would be boom, 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 and you would just continue that. You would continue this for 30 compressions. After 30 compressions, your assistant will either use an ambu bag, or if you're attached to your anesthesia machine, they would use the oxygen. With your ambu bag, you want to give 2 breaths every 30 compressions. If you're attached to your anesthesia machine, your assistant will of course give 8 to 10 breaths every 30 seconds. And you want to make sure that when you are giving the breaths with the anesthesia machine that you of course do not go over 20 centimeters. But you would like I said, you place your hands interlocked over the thorax, the widest portion of the thorax, like your elbows. And you'll give your 30 compressions, 2 breaths with the ambu bag, 8 to 10 with the anesthesia machine, and you would continue this. If for any case you get tired while giving compressions, you and your assistant can change places. But the important thing is to remember that if you do that, you cannot stop your compressions. So while I'm giving compressions, if I get tired, I need my assistant to take over. She needs to come over with her hands right on top of mine and start compressing as soon as I pull away. And then I would, of course, take over the breathing.